The objectives of this presentation are to identify the location and position of our maxillary, central, and lateral incisors, to illustrate and define the morphology and terminology of these individual teeth, to point out some identifying characteristics of these teeth, and to discuss some of the drawing criteria for these teeth. If we were to look to a skull, we could identify the position of these rather easily. There are maxillary 4 anterior teeth. We have them by number 7, which is our maxillary right lateral incisor, 8, maxillary right central incisor, and the same on the other side, 9 and 10. These 4 anterior teeth, being incisors, are involved with our cutting of our food or our biting or incising. They're involved rather significantly with our aesthetics and personality identification. These are the teeth that show most prominently in a smile. We also have significant value of these teeth in relation to our speech and phonetics and the proper enunciation of certain speech sounds. We'll study the relationship of our maxillary incisors to our mandibular incisors when we study mandibular incisors. In this presentation, we're going to be concerned mainly with the terminology. We have a large group of new terms which are characteristic for our incisor teeth. Let's look at some extracted teeth now, and we'll go over the individual terminology and try to point it out and review it here with you. And we'll be adding more terminology as we go. And then eventually we'll start to find out how these characteristics vary actually from tooth to tooth, central to lateral, mandibular to maxillary. Here we actually have a tooth that has some mamelons on. You won't find these as you study extracted teeth. It's very rare. This is the first one I've seen at all, but we did find one. And actually we talked about the sections that these teeth divide into in thirds. We've got these grooves or depressions that come up here, the mesiolabial and the distal labial grooves. This kind of divides it into thirds, and we're talking about a mesial third and a middle third and a distal third. Sometimes these thirds are called lobes around the developmental growth centers. So you could see this referred to as a distal lobe. We don't very often see mamelons in the mouth. Occasionally we'll see them for a few months during the eruption of the teeth in youngsters. In this instance here, we have a 23-year-old woman who is still showing mamelons. But she has an open bite and hasn't been able to get her anterior teeth together at all. Although in her left central incisor here, you can see that these mamelons are starting to wear off. Usually these mamelons will wear off within a matter of a few months after the teeth have erupted into the mouth and start occluding. Actually, we should at this time start to identify the mesial from distal for you. And in the labial view, and this being the labial, I think you can determine labial on this tooth rather easily. But as we study the labial view of other teeth, and particularly the facial and buccal view of the posterior teeth, this becomes much more difficult to identify. These we see in people's mouths every day, and it's rather easy. But on our labial surface here, we have 2 angles, and the angles are simply named by the surfaces which come in contact to them. One surface which we should identify before we even identify the angles here, I guess, is our incisal. The biting edge of these teeth is called the incisal, and this can be referred to either as an edge, incisal edge, or an incisal ridge. There is a little bit of difference between them. A ridge is generally a non-worn, rounded surface, like the ridges in the mountains in Tennessee or something, but an edge is actually a flattened surface that has been worn. And we'll go into the differences of that here later, but they could be generally referred to as an incisal ridge or an incisal edge, certainly the incisal portion of the tooth here. But on these angles now, the mesial incisal angle, that's the 2 areas in which it's closest to, the mesial incisal angle is sharp, and the distal incisal angle is considerably rounded. And generally just the central area here would be the distal incisal angle. But this is the most prominent way to tell the difference between mesial and distal on these 2 teeth. If we were to look at a outline of this labial surface, we would see that our labial is rather smoothly convexed. And our incisal edge is lying pretty much over the center of the root of the tooth. Our lingual surface has a concavity in here and is rather significantly different in shape from the labial. Now, one of the things we like to point out to you on these are the heights of contours of these teeth. And this seems to be a difficult concept for some to understand, so let me show you with a little Bowley gauge here what we're referring to. If you take a parallel beak instrument, such as your Bowley gauge, and lay it on your tooth, it will generally touch the tooth at the widest point. This widest point is called the height of contour. And on our labial surface, this is distinctly in the cervical third of the tooth. Same on the lingual surface as far as that's concerned in these teeth. This doesn't occur in the same place in all different teeth. But here it is distinctly in the cervical third of the tooth. If we look at the labial surface here and put the Bowley gauge on the mesial and distal outlines here, we find that we have height of contours which are again different. On the mesial surface, this height of contour is very close to the incisal edge. This is contacting the adjacent central in the mouth. On the distal surface, our height of contour drops down a little further onto the distal surface. This is contacting a smaller lateral incisor. Now, where these points touch, if the tooth is in the mouth straight, we have what is generally referred to as our contact areas. If it was very crooked or out of position, it could have a different contact area, but generally the contact areas will be at these height of contours on it. Now, we could draw in a couple areas here. How about if I were to draw in this area? What would we term this? We have the sharp angle here, and this is a angle of our box. So we'd have our mesial, labial, line angle. And we'd do the same on the distal portion of the surface of the tooth. We'd have our distal labial line angle. We've got our two grooves, distal labial groove and mesial labial groove. We've got a cervical line which we can recognize on this tooth. And notice how the cervical line actually is going. It's at its most apical portion, right in the center of the crown here, or in the middle third, I guess you would say, of the crown, to get our proper terminology on it. Let's turn over to the lingual surface and see if we can identify some of the anatomy on the lingual surface here. Lingual surface is characterized in this view by having a rather strong protuberance right here. This protuberance is probably the most characteristic area on the lingual surface. And this is our fourth growth center, actually. And it didn't really grow too much in this tooth. As we go to some of our other teeth, we'll find that this actually grows into a full-size cusp, or a point which is equally as high as the incisal edge, but it's a growth center which grows a little bit. This is called the cingulum. This is a very important terminology. Cingulum is this whole area around here. The height of contour is on the cingulum, but on the lower portion of the cingulum down towards the cervical line. It gets a little easier to talk about these once we start identifying some of this terminology, because we can refer from one to another. We've got some ridges that occur on this lingual surface, and these are called ridges according to the surface they're on. We've got a mesial marginal ridge. Get over to the pointed side here so we can get our mesial marginal ridge, and a distal marginal ridge. We've got some general areas on this lingual surface, which is this whole depressed area in here. And this is a fossa. A fossa is a general depression. So we've got a lingual fossa. Sometimes this lingual fossa will end up in a little bit of an apex or a very sharp point. And this would be referred to as a lingual pit. We haven't got a real strong lingual pit on this area. Pit is more of a point rather than a general depressed area. So those are our basic terms on the lingual. We've got a cingulum, our mesial and distal marginal ridges, our lingual fossa, this whole scooped out area, and a lingual pit, if it's a point or if it's present in a small area. We have our cervical line, very similar to the labial, and it also goes towards the apex the most in the middle third of the tooth. Now, if we were to look at this cervical as we tip over here to the mesial and follow the cervical line around here, we would find that it comes up closer to the incisal edge as it comes to the mesial. So it's a continuous curve going up and down as it comes around the tooth. And this is very important. You'll have to know exactly where that is in order to do operative and periodontal and other services to this tooth. But if we look at the mesial surface here, we'll find that there's not a lot of strong characteristics to it and not a lot of specific terminology that we haven't covered, but our mesial contact area would be the strongest single term on this tooth, which is usually at the height of contour, this as we showed on the Bowley gauge. The distal surface has a little bit of difference here. One of the differences is that our cemento enamel junction, or our cervical line here, doesn't come as close to the incisal edge on the distal as it does on the mesial. The mesial just dips rather close to the incisal edge and usually closer than on the distal, and you frequently can distinguish this as a characteristic. In other words, if this tooth was worn off right down to here, you'd have a little bit of difficulty telling which of these angles were the sharpest. You'd have to start to look towards other characteristics, and this is one of the characteristics that you can use for identification. It's one you also have to be aware of in doing crown preparations and other things on these teeth. But we've got our distal contact area on this distal surface, which is usually further from the incisal edge, or a little lower. This is contacting a smaller lateral incisor. And as we go posterior, sometimes this has a tendency to get closer to the cervical. I say lower, I mean closer to the cervical actually here. If we look at an incisal view, another tooth here, we can see the position of the cingulum in relation to the tooth. The cingulum is either centrally located on this lingual surface, or sometimes it has a tendency to be located off towards the distal a little bit. This is in line with the curvature of the arch that is occurring here. But the mass of it frequently will be a little bit to the lingual. In relation to this incisal edge here, we can have, as I said, either an edge or a ridge. And on our non-worn teeth, we've got a rounded area up here, which is called a ridge, technically. And in a tooth that has had quite a little wear to it, we get a flat surface on here. And this wears frequently to the lingual side because of the way the lower teeth come out over it in occlusion. And so we've got an edge that's tapering to the lingual. And it's generally referred to as an incisal edge. Actually, you'll find that sometimes this terminology will become even more specific, as much as when they're talking about the incisal edge, they could talk about the labial incisal edge, which is the edge right in between the labial surface and the incisal, and the lingual incisal edge, which would be the flattened edge towards the lingual of the incisal. I don't think these two terms are spelled out specifically for you in cards or handouts, and sometimes aren't real specific in the literature, but you occasionally will hear people refer to the labial incisal edge or lingual incisal edge, and they're actually breaking this flattened surface down into two edges. Let's look at the root portion of this tooth a little bit. The roots are characteristically cone-shaped, frequently having a fairly blunt apex. This doesn't usually come real pointed, and it doesn't usually curved one way or another, although you find many variations on it. Looking at our outline form, we'll find that as we compare the crown and root totally on the mesial, that we have a very small dip at the cervical of the tooth on the mesial surface. But as we look to the distal, usually this becomes a little bit more prominent, and we'll pick up just a little bit more of a concavity in between the crown and the root, right at the cervical line, or the cervical area of the tooth. Another thing in relation to this root that I think is quite important is the fact that through our labial surface here, we're quite broad. And this actually becomes flattened in through the labial surface on the root structure, at least in the cervical third of the root. And as we look to the lingual, this becomes very rounded and actually gives us a triangular root with a broad labial surface and a rather narrow lingual surface. Another thing on these central incisors I should try to clarify a little bit, and that's the difference in terminology between our line angles and our marginal ridges. On the lingual surface, this becomes a problem sometimes. If we were to consider our marginal ridges as being the height of our ridge on the lingual surface, we actually would have a different area in relation to our line angle, the line angle being the junction between the two surfaces. Our mesial surface and our lingual surface here. Our line angle actually would be out more in this area here. And sometimes this gets confusing to students, particularly if they're asked to identify the difference between these two on an examination or something. We'll try not to get quite that confusing for you, but the line angle is actually the two surfaces. We'd have a mesial lingual line angle, and the red one would be your mesial marginal ridge. Now we can look at our maxillary lateral incisors. It has basically all the same terminology. And now that we have the terminology somewhat in hand, we can start to use this in referring to the teeth and in describing them. We'll do more of a comparison study of the centrals and laterals rather than going through all the basic terminology on it, pointing out the differences on these teeth basically. Now, these are the maxillary lateral incisors we're looking at now, and this would be tooth number 7 and 10 in the mouth. This particular one's our left, so this is number 10 here. We'll note that in kind of a comparison here, that our lateral is smaller. It's smaller in mesial distal width rather significantly. It frequently, at least in the mouth, is a little bit shorter than the central, unless the teeth have gotten worn, and then they'll wear down rather evenly. But this leaves our contact a little bit lower on the central and leaves it about in this area on the lateral here. Now as we go to the distal of the lateral, we'll be contacting a cuspid, and our contact becomes closer to the cervical even yet.